Hello, my name is Stephen Parker. I'm proud to be the chairman of the upcoming Laser Summit to be held in Dubai on the 21st, 22nd, and 23rd of September. As part of the promotional material for this prestigious event, I am delighted to introduce some of the speakers to discuss some of their presentations. And today, it is my pleasure to introduce to you Dr. Justin Kolnick. Dr. Kolnick is a specialist endodontist. He's in private practice in New York City, and he routinely uses laser technology to augment his clinical practice. Justin, your use of lasers spans, I understand, some 15, 16 years. How do you see that the integration of laser technology has benefited your daily practice?
Well, first of all, Steve, thanks for having me as a part of this symposium. I'm really excited to be in Dubai. The introduction of lasers has significantly changed the way we perceive, predict, and perform endodontic therapy. It has certainly a significant impact on the outcomes of endodontic therapy and also the ability to predict outcomes. This is really important because it becomes an integral part of multidisciplinary dentistry. And just in general, I would say that the introduction of this technology has enabled us to successfully manage endodontic disease and endodontic complications.
Your choice of lasers, you have, I understand, your mainstay is the erbium chromium YSGG, free running pulse laser, but you also utilize laser technology in the delivery of photobiomodulation. To those who are new to laser technology, within endodontics, there appears to be a number of acronyms that describe the way in which these free running pulse lasers are able to deliver benefit. How do you, or can you possibly explain to us briefly how you see the use of this energy, how it is manipulated, and the kind of outcomes that you expect by using these lasers?
Sure. So, most people, when they hear about lasers in endodontics, they think purely about cleaning and disinfection of root canal systems. Of course, that's the primary application, but there are many other applications that the laser helps us with that allow us to overcome many of the complications that we encounter during endodontic therapy. Specifically issues such as loss of patency, managing calcified root canal systems, achieving drainage and decompression of periapical tissues through the root canal system, managing resorption issues, both external and invasive cervical resorption, and of course all other complications related to perforations within root canal systems, retained or separated instruments. And so the way that the erbium YSGG energy works within the root canal system is primarily by activating an irrigant within the root canal system. And this creates a cavitation effect, which imparts a high velocity to the irrigant, forcing it through the root canal system like a shock wave. And this allows the energy and the irrigant to reach all the nooks and crannies, the inaccessible areas within the system. So this changes the way we can now predict outcomes. The two main issues about predicting outcomes relate to the creation and establishment of patency, and as well as the extent or depth of cleaning or disinfection of the root canal system. So because these two main features are very easily maintained and created by this energy, we now have a very high prediction rate, well over 95%, for long-term success of complicated root canal issues. The use of photobiomodulation in endodontics is really interesting, because the ability to stimulate healing and reduce inflammation becomes really important for us, not only in conventional endodontics, but also in surgical endodontics, where we're able to stimulate new bone growth in the osteotomies of apical surgery, but also in the management of soft tissue issues that we encounter, primarily myofascial issues, where patients are dealing with acute pain as a result of trigger points in the masseter or pterygoid muscles. And by managing these areas, we are able to also control and treat the overall pain that the patient is experiencing in not only the jaw, but also in the face. So it really has been a game changer, and certainly within the last 2 years, it has now become mainstream in endodontics in the United States. The endodontists in the United States are now adopting this technology. They're aware of this technology because for the previous 14, 15 years, it was really a very difficult, was really difficult for me and our colleagues to explain the importance and illustrate the importance of this technology in endodontics. So really, it has been a game changer.
It's fascinating to hear you talk in such positive terms, and certainly the presentations that you will give in Dubai will allow you to back up these claims with excellent pictorial radiographic results. In many ways, despite best effort over the last 30 or so years, the parallel treatment profiles of dealing with endodontic failures, and also the growing number of implant cases that are bedeviled by peri-implantitis, there is a balance of consideration as to which forms a best practice profile for many patients. You feel confident in yourself, do you, that the approach that you bring to the treatment of these cases, many of which, of course, are failed endodontic cases to start with, allows you to shift and maintain a natural dentition rather than to extract the tooth and place an implant with the associated risks associated by placing implants? Your views, if you would, please.
Sure. I think a very important part of my role and others who have been spreading the word, so to speak, is to educate the restorative dentist as to what it is that we are now able to achieve with endodontic therapy today. Once the restorative dentist or the general dentist understands this, this can really change the way treatment plans are formulated, because many teeth that have been deemed to be hopeless in the past are now treatable. And by educating not only the restorative dentist, but the endodontist as well, we are now able to change really the way the long-term outcomes or prognosis of questionable teeth have changed. And this gives the general dentist or the restorative dentist the ability to modify their treatment plans because teeth that have that in the past that have been really pivotal or really play an important role in the patient's dentition, that were previously deemed hopeless, can now be treated quite successfully. And you know, we will like to show at this conference, at the symposium, an evidence-based approach to what it is that we are bringing to the table in terms of multidisciplinary dentistry and multidisciplinary treatment planning. So yes, I think that even for those dentists who do not use lasers, the endodontist often is a very important part of their restorative team, as well as the periodontist and maybe the other specialties. And by them recognizing this and incorporating endodontists who utilize this technology, it will certainly change the way they will perceive their cases.
Excellent. Well, Dr. Justin Kolnick, you are most welcome in Dubai in September the 21st, 22nd, 23rd of September. This is a prodigious event. We are very hopeful that the message will be one of lasers being a positive adjunct to everyday dental practice. We encourage our colleagues to attend. We look forward to both the scientific, the practical, and the social events that will follow. For the moment, Justin, thank you very much indeed for your time, and we look forward to seeing you again very soon.
Thank you, Stephen, for having me on, and I really look forward to meeting, learning from everyone else at the conference, and I'm really excited to be there.